and welcome to Ask the Horse Live. I'm your host, Shoshana Rudski, digital editor at The Horse. Tonight, we're discussing joint health. We'll delve into what causes joint issues, what you can do to keep your horse's joints comfortable, and considerations for sport horses, older horses, and everything in between. This event is sponsored by Boehringer Ingelheim. To answer your questions tonight, we are joined by two expert panelists, Dr. Erica Secor and Dr. Julia Settlage. Welcome to both of you.
Thanks so much. Happy to be here.
Dr. Secor, can you tell us a little bit about your background in equine veterinary science?
Yeah, absolutely. So I grew up in small town Vermont and grew up with horses. So becoming an equine vet was kind of an easy decision for me. So I did my undergraduate in vet school at Cornell University and finished vet school in 2013. I went on to do a one-year internship and then a surgery residency at the University of Illinois. And at that point decided to go into private practice for several years. So I was in private practice as an equine surgeon for about 4 years, and decided I had done a lot of research during undergrad and vet school and really enjoyed it during that time, and decided to make the transition back into the research sphere and started my PhD back at Cornell again. So I'm in the second year of my PhD program now. And in particular, I study equine osteoarthritis with a little bit of carryover to human arthritis as well, and particularly the role of the immune system and immunology in the development of osteoarthritis.
Great. And then Dr. Settlage, can you tell us a little bit about your background and your role at Boehringer Ingelheim as well?
Absolutely. And first I want to say thank you for having me tonight. So I am a little bit different than Dr. Secor. So I actually was a horse-denied child. And so I blame my parents for me becoming an equine veterinarian because I wanted everything horse. And it wasn't until I got to college that I was able to actually indulge in horses and seriously indulged in horses and made it my mission. So I wasn't ever going to be an Olympic level rider because of my late start. I needed to have a profession where I was going to be able to touch horses all day. And so I became a dedicated student to becoming a veterinarian. And so I ended up going to vet school at Virginia Tech and bounced around for a little bit after my internship and residency. So I'm also a board certified equine surgeon, and then ended up back at my alma mater in 2009 and was on faculty at Virginia Tech, fulfilling my love of teaching as well. And left there in 2020. I left academia then to pursue a career with Boehringer. And so what my role is at Boehringer Ingelheim is I'm an equine professional services veterinarian, and it is the best of both worlds because I still get to teach, which is my passion. I get to teach horse owners, I get to teach veterinary students still, and I also get to teach equine veterinarians in areas of my expertise, which is lameness, sport horse medicine, and anything surgery, but then also in any of the disease processes that Boehringer has treatment modalities for. And it's just absolute pleasure. And I love traveling to different clinics and to different areas of the country to be able to share my knowledge and learn also from those equine clinics as well. So it's just a perfect job for me.
Perfect. We're super excited to have you both here. And before we dive into our questions, I want to remind everyone of our Ask the Horse live format. We're starting with questions submitted during the event registration. If you're listening live, you can ask questions via the chat window on the app. We'll do our best to get to as many of them as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump right in. To start, Dr. Secor, can you tell us what red flags should alert owners that their horse might have joint discomfort?
Yeah, this is a really great question, and something that has a lot more nuance than what we necessarily kind of automatically think of. So, the obvious ones is, a horse that's lame. They're sore with what they're doing. They're starting to not do their job as well. So that's certainly, kind of the biggest red flag out there. But I think as horse owners and veterinarians, I think we've all gotten more kind of in tune with our horses and realizing that there can be much more subtle signs. So some other things that I've seen in some horses that ended up having joint discomfort and some pain is, like I said, not performing quite as well. They might still be doing their job, but they're a little bit grumpier doing it. They're not quite, at the level that they used to be. Some behavioral changes too. I've had some horses that get really grumpy being in a stall that have never been like that before. And, I think it's likely because they're getting sore being in their stall. Other kind of behavioral changes, if they're getting grumpy with other horses or, starting to move when you're trying to, mount them when they haven't done that before. All of those can be, potentially things that, require some extra, looking into to see what the cause might be.
Awesome, great. And then also sticking with you for our next question. When talking about joint health, are we thinking just about arthritis, or are there some other conditions we should be thinking about as well?
This is another really great question, and certainly osteoarthritis or arthritis is far and away, it causes the majority of our lameness cases in horses. But that being said, there's a lot of other disorders and things that can cause joint discomfort and concerns with joint health. So certainly soft tissue injuries, and those can both be ligaments kind of supporting the joint, muscles that again kind of support the joint and support locomotion can contribute to overall joint health. When we look at young horses, there's some developmental joint disorders that we need to be concerned about sometimes. And kind of in this kind of sphere of intra-articular within the joint, but there's several joints that have kind of supporting soft tissues right within the joint as well. So one of the big ones we think about is the stifle. We've got, the same as a human knee, we've got like an ACL. People, a lot of people injure their ACLs. Horses have ACLs as well. Thankfully not as commonly injured as in people, but can be a source of lameness. They've got menisci in there that, again, that one is a relatively common cause of stifle lameness. So arthritis, or kind of, the cartilage damage that we think about with arthritis, is certainly one of the big ones contributing to overall joint health, but there's certainly a lot of other disorders and conditions that we need to be aware of and kind of have on the radar as well.
That's really helpful. Thank you there. And then going over to Dr. Settlage for our next question. Lauren in our live chat is wondering what age you typically see horses starting to show signs of osteoarthritis or other joint concerns.
Yeah, so a lot of the times we think of arthritis and joint problems happening in the older horses, but a lot of it depends, and that's true, that does happen because our osteoarthritis is an accumulation and a progression. So it starts really mild and over time can accumulate more and more of the osteoarthritic changes that ultimately will result in some lameness, if not, or having some lameness even earlier. But depending on genetics and workload of the horse, as Dr. Secor said, whether or not they have any developmental joint problems that they were born with or developed in their youth, all of those can contribute to arthritis and having joint issues at even a younger age. So there is no age group that is eliminated from having the possibility of joint issues. Granted, the older the horse, the more likely to expect to have joint issues in a younger horse, but certainly all horses can have joint disease.
Great. And then with you again for our next question. Nan in Arizona is wondering what early signs of joint overload or issues there might be and what owners should be looking out for in their horses.
Yeah, unfortunately, the earliest signs of joint overload can oftentimes be really, really hard to detect. And so we call that subclinical in the veterinary realm. And what that means is that it's there, but we don't have sensitive enough fingers and eyes to necessarily catch an overt symptom that I could tell an owner, look for these things. And that's where if we could figure out how to intervene at that level, we might be able to really have an effective way of slowing down the progression of joint issues. But that being said, things that you could look for are getting really good at feeling your horse's joints. So you work with your veterinarian or other knowledgeable horse people to really get a feel for what's normal in your horse, and then get a sense for early, what we call effusion or swelling within the joint. That might be an early sign that can preclude lameness. Knowing what the normal range of motion is for each of your horse's joints, because if that decreases, they can't flex as much or flex their knees as much, then that also might be an early sign that might happen before they are overtly lame or showing overt grumpiness that was alluded to earlier. And so that can be really, really subtle. But oftentimes, unfortunately, the veterinarian is called out beyond the early signs, and it's actually when the horse is showing overt lameness. And so it can be really difficult to see and understand what the horse is showing you.
Thank you for that. And then going back over to Dr. Secor for our next question. This one is from Julie in Texas. She's wondering if a certain amount of arthritis is considered normal in a horse.
Yeah, that's a great question, and kind of along the same lines that Dr. Settlage just said. Certainly in older horses, there's wear and tear on the cartilage, wear and tear on the soft tissues that kind of make up the joint. It's great. Our horses, everyone's taking great care of their horses and they're living longer and longer. But, the problem that we start seeing is, we have a certain amount of wear and tear. And now that they're kind of, to some degree, some horses starting to outlive, their cartilage to some degree. So, I wouldn't say that it's normal. Certainly a lot of my research and a lot of the research that other people do is, like Dr. Settlage said, trying to diagnose these horses earlier and be able to intervene earlier, that, hopefully we can start to, do a better job at postponing the development of arthritis. But certainly, again, especially in the older horse population, it's extremely common. So it's something that, as your horses are aging, especially if, you're still using them and still exercising them to some degree, it is certainly something that, a lot of horses do need some management of down the road.
And then going right off of that, Janet in our live chat said that she has an older 28-year-old horse, and she's wondering if it's possible for him to have osteoarthritis, even if he has never done much that physically in his life.
Yeah, it absolutely is. Again, there's so many different factors that play into, the development of osteoarthritis, both in horses and in people. There's certainly genetic predispositions, certainly, wear and tear from, exercise when they were younger can certainly, play a role. That being said, the opposite can also play a role, and one good model for developing osteoarthritis is putting a horse in a cast. So it's that fine balance of enough exercise, if you don't use it, you lose it kind of mantra. But certainly, accumulating injury can certainly cause, excess wear and tear as well. So it's certainly, being an older horse wouldn't surprise me if he does have some degree of osteoarthritis, even if, he wasn't a high-end performance horse in his younger days. But certainly there might be the possibility that he's one of the lucky ones that has managed to get to 28 without painful joints too.
Thank you. And then going back to Dr. Settlage for our next question. Pamela in Colorado is wondering if there's any link between joint issues and an increased risk for soft tissue injuries.
That's a good question. And so it's chicken and egg, right? And it could go both ways. Do soft tissue injuries predispose to joint issues, and do joint issues predispose to soft tissue injuries? And the answer is yes, that one can lead to the other and the other can lead to the one. So, and that's why it's really important to get at a horse from a holistic point of view, is what is the primary problem and what are the secondary problems? And that's where a veterinarian can really come in handy, because I can use my own body as an example. I have a really bad knee from a horse accident, and now that's actually making my back hurt. And the same thing can happen in horses, is that they can have osteoarthritis in one set of joints, say the hocks, because that's not uncommon, that might present itself as some lumbar. Both are real, and both can cause the horse, performance issues. And in this particular case, my hypothetical, the primary problem may be the hocks, but in another instance, maybe there's a soft tissue injury that's causing the horse to carry themselves inappropriately, that can put abnormal forces on a joint that could then cause some inflammation in that joint and set them up for some joint disease. And so it can go both ways. Sometimes it can be really difficult to tease out which one came first in a given horse.
And then following along with that whole kind of whole horse approach and looking at the horse as a whole, Sherry in California said that her horse is having more problems going up hills than on flat ground or going downhill. Might this be joint involved, or might something else be going on as well?
That's a great question. And unfortunately, that is one detail in the midst of all the things we would be looking at when we watched a horse like that. And so when if they're having difficulty going up the hill, but maybe not down the hill, could it be a muscle weakness thing? Could it be the joints that really take the brunt of the weight of the horse that's causing them pain? Say that, they really have to support themselves on their back end. And so could it be a back, hock, stifle issue, or even some fetlocks could be bothering them? And so I would want to do looking at the whole horse if an owner called me with that kind of complaint, and see if I could figure out what's going on with them. I'd look at muscle symmetry. I would do a normal my normal lameness exam, which would include looking at the move on the flat, as well as range of motion, hoof testers, all of the things. And so it's hard to say if that's just joints or if it could be something else.
That's a super helpful answer there. And then for our next question, we're going to go back to Dr. Secor. And Jennifer in Kentucky wants to know what she can do when conditioning her competition horse to help keep his joints healthy.
Yeah, this is an area where I think we're starting to get better at recognizing the necessity for kind of keeping the soft tissues strong. And like Dr. Settlage was saying, the soft tissues and the kind of joint tissues themselves, there's this really fine interplay. So certainly keeping all of the soft tissues strong and conditioned are going to help prevent, injuries, both soft tissue injuries as well as joint injuries, while they're competing. So yeah, it's really important, finding that balance between, keeping them adequately conditioned but not overdoing it is really important. And that's where I really, I'd recommend, because it's going to depend a lot on exactly what kind of competition this horse is doing, and if there's any other issues with this horse, joint issues or otherwise, to kind of take into consideration. So this is where I think Jennifer could work really closely with her veterinarian to come up with a really great conditioning plan for that horse, making sure that he's staying, fit enough, conditioned enough, strong enough to, do the job that he needs to do, and, hopefully prevent, excessive wear and tear and, things like that, but not overdoing it and getting to the point of fatigue and then having, issues with fatigue and overdoing it.
Perfect, thanks. And then going to Dr. Settlage for a bit of following up with that. Mary from Maine said she is currently bringing her 18-year-old warm blood back into work, and she's hearing a clicking noise when he walks, but she doesn't feel any heat anywhere. Could that be joint related, or is there something else she might want to be looking at as well in that?
The creaky horse. I think we all probably have one of those in our lives. It certainly could be a sounds coming from joints, but does it mean that there is definitely joint disease or inflammation even present? Not necessarily. But that being said, I do think it's worthwhile for, especially if it's new, or if it comes and goes, for a veterinarian to actually take a look and see, because if it is something that is just quietly clicking, it might, and it is a future source of lameness, how nice to be able to try and figure out that now and trying to slow down any progression or to nip potential lameness in the bud, so to speak. But sometimes figuring out where that clicking is coming from can be really hard, because the other things that can cause clicking is tendons or ligaments just popping over a prominence on the bone, and that might not necessarily mean that there's a problem in that horse. It just could be an anatomy thing, and it might not ever predispose them to injury, but they're so big and they can't point to where they might be feeling that click come from, like you and I could if we went to the doctor with a click. And so sometimes these are really, really hard to figure out. Is it a stifle? Is it a hock? Is it somewhere in between? Is it something different? But yes, it could be joints, but it might not. Unfortunately, that's a hard one to follow up with on a horse.
Thank you for that. And then for our next question, we're going to go back to Dr. Secor. Jacqueline in Massachusetts is curious if alternating between joint injections and systemic injectables would be an effective option for a horse.
Yeah, that's a great question, and one that I have owners ask me a ton. So there's lots of different considerations for coming up with a good treatment plan for a given horse. A lot of times we just think of, we have an arthritic joint, we inject it. But there's so many other good options out there. So certainly one thing that plays a lot into my decision making for coming up with a treatment plan for a given horse is, are we treating one joint or do we have lots of different joints that are involved? So if we've got, an older horse, they've got hock arthritis, a little bit of fetlock arthritis, maybe some coffin joints or something, we start adding up a lot of joints to medicate. And those are the ones that I really do like reaching for some of those kind of more systemic options. And there's lots of different systemic options out there. So those are certainly ones that I very much consider kind of, doing a multimodal therapy there. But that being said, even a horse with just a single joint that we're treating, I've certainly seen a lot of benefit. Again, this multimodal therapy kind of attacking, the disease process or the pain pathway from several different angles can oftentimes give us better overall outcomes. There's only so much that our joint injections are going to be able to do, but if we can kind of help target that pain from another avenue as well, we oftentimes can get kind of synergistic effects from those. So I certainly find with some of the systemics, some horses seem to respond to one more than another. And you'll find that with kind of, at least I've found that with, all of the treatments out there. There's some horses that, one treatment than another. So it's going to be a little bit of a trial and error to some degree. But that shouldn't, kind of dissuade people from, giving that multimodal approach a try. And it might just take a little bit of finagling to see what works best for that horse.
Great. And then sticking on to treatment ideas as well for Dr. Settlage, Joan in British Columbia is wondering if there are any special considerations for treating joint issues in a horse who also has PPID.
So, Joan, that's an excellent question, and I'm going to broaden it a little bit to not just be pointing a finger at PPID and envelop all of our most common endocrine disease. So that would include PPID and equine metabolic syndrome, and I would say equine metabolic syndrome is of more concern than even PPID is. And these are horses that may be particularly sensitive to corticosteroids. And so that is the main special consideration for treatment for horses that have those metabolic conditions, is that if they are not well controlled, then avoiding corticosteroids is probably the wise maneuver, because these horses are more at risk for developing laminitis just on a good day, and the steroids can increase their risk of developing laminitis. And so that's the last thing we would ever want to do to a horse or help cause in a horse. And so the other thing with PPID that I think people need to remember, and this is why it's also really important to get an early diagnosis of PPID if there's any suspicion, is there's been some recent research that has shown that horses that have PPID are also at increased risk for developing suspensory ligament issues. And that is another, it's not joints, but it's certainly another source of lameness that the endocrine, the PPID can predispose to, and is worth trying to eliminate that as a risk factor in the development of another disease process or lameness issue that can be just devastating in the life of a horse. So great question, Joan.
That was a super answer there. That was super helpful. I know I have a few horses at home who have PPID issues, so it's always good to kind of, have that in mind for them. And then for our next
Absolutely.
question,
And
yeah, sorry, go on.
no, I was going to say, if they're well controlled, like if the endocrine diseases have been identified and treated well, then their risk is, and it's under control, and their risk is lower. And so again, working with your veterinarian to decide what the appropriate joint treatment is, with what the horse's job is, what the owner's budget is, and then the pros and cons of what the treatment is. And steroids might still be part of that picture, but you'll feel a little bit better if that endocrine disease is well controlled.
Exactly, that's super logical there. For our next question, this is going to go to Dr. Secor. Carrie in our chat is wondering how she can best support horses who have had joint surgery in the past, such as having bone chips removed, screws placed, etc., and anything she might want to think about going into the future with them.
Yeah, great question. So a lot of that will depend on what exactly was done. So, we talked a little bit at the beginning of developmental diseases in young horses, and OCD lesions are one of the common ones. That's a pretty common kind of joint surgery in young horses. And thankfully for a lot of those, I won't say all of them, but a lot of them, the prognosis is pretty good, that once you take that out, they do pretty well. And for the most part, you don't need to worry a whole lot about that joint down the road. But certainly things like screws, if they had an old fracture or something along those lines, those might need a little bit more kind of careful monitoring. So again, I'm not a big sticking needles into joints if I don't have a good reason to, if we don't have any lameness or pain associated with the joint at a given time. But those certainly would be joints that I'd be keeping a close eye on. So if they do start getting kind of swollen and effusive, having extra fluid in that joint, again, kind of keeping an eye out for some of those early, kind of early behavioral or early lameness kind of signs. I certainly would have those joints on my mind. That being said, though, I've certainly been burned before of trying to, kind of jumping to the obvious, one that, has screws in it and had the lameness be, coming from elsewhere. So, yeah, a lot of it's going to depend on exactly, what was done. But certainly, some of those things that might predispose them to arthritis in the future, I'd just be keeping a really close eye on, the development of any lameness and kind of tackling it from there.
Thank you. And then we have another question about OCDs and stifles. But before I get into that, would you mind explaining exactly what an OCD is?
Yeah, so OCD is osteochondrosis dissecans. So essentially, these are small little cartilage with, depending on the lesion, sometimes have a little kind of bony core. And essentially what these are When the horse's bone was developing and what we call ossifying, so turning from cartilage into bone, they can sometimes get these kind of defects where the process didn't go without a hitch, and it can lead to these small little fragments. So they're pretty common in the hocks. We see them quite frequently in stifles and fetlock joints as well. Less common in other joints, but essentially most joints could potentially have OCD lesions. And they tend to be diagnosed most often in pretty young horses because they're a developmental lesion. But certainly some of them stay pretty quiet and you never know they're there. So.
Perfect. So going right off of that then, Jill in Ohio said that she has a mare with an OCD in her stifle, but she's sound and performing her job totally fine. Should she still consider removing the chip, or should she just kind of let it be for now?
Ooh, that is a great question. So stifle OCDs are one of the trickier ones because some of them, depending on the location and the size, can vary the prognosis a little bit. I guess depending on how old this horse is, it sounds if she's doing her job fine that she's, not a yearling by any means. And, if she's doing her job fine, doesn't have any other signs of joint disease, it certainly sounds like it's probably a pretty quiet OCD lesion. But this is certainly one I've seen them not necessarily in the stifle, but some other places kind of dislodge later on in life. But keeping in mind surgery is a big deal. So I would certainly, kind of recommend keeping a really close eye on that joint. If anything changes either in her comfort or the degree of fluid in that joint, like if she starts looking swollen around that joint, certainly, be looking at radiographs and an ultrasound of that joint and a lameness exam sooner rather than later to make sure everything is still pretty quiet.
Great, thanks. And then for our next question, we're going to go back to Dr. Settlage, back to talking about injecting joints a little bit. Darren in Vermont wants to know what age is typically appropriate to begin injecting joints.
Great question. And when the joint needs a joint injection, that is the appropriate time to begin injecting joints. And so, if you have a young horse that maybe has had an OCD taken out of, I actually, as part of my postoperative plan, it's not uncommon for men that horse get 1 or maybe 2 joint injections as a part of its postoperative plan. But that's with the hope of, in that particular case, hopefully not having to continue doing that as the horse continues to heal, versus the other young horses that have a lot being asked from them. We have a lot of sport horses that have to do pretty mature things at a young age, and so they're going to accumulate a lot of wear and tear even at a young age, and so those horses might need to have their joints supported by joint injections. And so there isn't a right or wrong answer. If a horse needs a joint injection, it should get a joint injection, because early intervention can do a lot to slow down that progression of osteoarthritis. And just because a horse might need an injection, say as a 2 or a 3-year-old, if well maintained, well managed, with a really good warm up and cool down and special particular interest paid to that joint, it might not need frequent injections. And then if ever its workload goes down, there's a chance that joint might not ever need joint injections. And so it's just a whole mixture between the ask of the horse, the condition of the horse's joints, and its future needs. And so, yeah, no particular age.
Great. And then following up with that, Sue in California is wondering if there's any long-term risks associated with joint injections that she might want to be aware of before she starts considering them for her horse.
Sure. So there's a lot of thoughts out there that once you start injecting a joint, you got to keep injecting a joint. And then there's also a lot of thoughts that over time, joint injections stop working and you have to start reaching bigger what I'll call ammunition to help quiet down that joint, and potentially that equates to increased cost. And so the way I like to look at joint injections are, how can I be the kindest to that joint? So first, do no harm, right? So I want to make sure I'm not putting anything in there that will just cover up symptoms, make the length go away, but is there also something I can put in there that might help slow down the progression of the disease of osteoarthritis? So is there something I can put in there that's disease modifying in a good way as well? And so again, yes, if that joint needed to have a joint injection to quiet down whatever's going on in there, there is a strong chance that that joint will need to be injected in the future. But as far as an individual product or an individual drug causing problems, the only ones, there's, a mainstay. It's, I've been in practice for 22 years. And so if you add vet school on top of that for exposure to knowledge of what can go in joints, so for 26 years, Depomedrol is a steroid that is commonly used and has been commonly used in horses. And so there's been research that has shown that that can actually be as good of a drug as it is to get rid of lameness. It can also cause harm to the cartilage over time, especially at the higher doses that we might use in a joint. And so that is a drug now that I in my practice and in my philosophy, I avoid. And contrast that to another steroid that is commonly used, is triamcinolone in joints. And that out of the same lab out of Colorado State, they've actually shown that steroid at appropriate doses is actually helpful to cartilage and can help keep it healthy. And so it's hard to, most things we put in joints though are helpful and have some disease modifying effects. And so the joint injections themselves are not likely to have long-term adverse events. That being said, the joint is a special place and we don't want to make it infected. And every time we put a needle in something, there's a chance that we're going to carry bacteria from the outside on the skin into the joint. And so that's why when you have your horse's joints injected, the veterinarian will spend a lot of time making sure that that skin is low in bacteria. So they'll prep on that, the needle in the joint, and they'll often, most of the time, hopefully they are wearing gloves, sterile gloves, to again can prevent the carriage of any bacteria into joints that could cause a joint infection. Can be devastating. Worse. And so there's some other things, joint flares, which is a profound inflammatory response, relatively random occurrence and not very frequent, but then you might hear secondary to joint injections. But again, it's hard to predict, and luckily it doesn't happen very frequently. But all in all, joint injections are relatively safe and should not be detrimental to a horse's joint.
That's super helpful. Thank you there. And then for our next question, Dr. Secor, Lisa in our live chat is wondering if you can weigh in on stem cell therapy for joint issues.
Yeah, good question, and one could probably spend an entire podcast on in and of itself. So I use them in particular situations. So there's a few different kind of varieties out there. So there's adipose derived. So essentially a small amount of fat is taken from your horse, and then the stem cells are isolated from there and grown up and then can be sent back for injection. There's also bone marrow derived stem cells, which again, taken from your horse, and the bone marrow is taken and again, kind of sent out, stem cells isolated and grown. And there's some options out there of essentially what we call off-the-shelf stem cells. And these are derived from young horses that don't survive for whatever reason. And so typically, everyone, all veterinarians kind of have their, what they've used and what they're comfortable with. The ones I've used the most are the bone marrow derived stem cells. One of the kind of hitches with it is it can take several weeks for those stem cells to grow, so you're not going to be able to do it right away. But I've certainly used them, and I've tended to use them more just in my practice with meniscus injuries, and I feel like they help some of my meniscus injuries. I certainly know other people that have had good luck with them with treating osteoarthritis and some other kind of joint disorders. The literature out there, it's a little tough because there's a lot of kind of variability from horse to horse, lab to lab. So it's hard to design a really good study to really look at all of those, kind of take into account all of those variables. But there's certainly situations where I think they can be beneficial. So.
Great, perfect. That's super helpful there. And then following up with that, Kimberly in Kentucky said that she is doing a pre-purchase exam on a 5-year-old mare off of the track. And she said that the mare had mild arthritis that showed up in her fetlocks on her pre-purchase. She's wondering if that is a big enough problem not to buy the mare, or if you think it might still be worth it with that. And I'd love to hear both of your thoughts on that, but we'll start with Dr. Secor for this one.
Yeah, this is a question that I get a ton. So, thoroughbreds, they certainly have a lot of wear and tear on those joints, and certainly fetlock arthritis is pretty common in them. We see it a lot. And this is another area of a lot of research, especially with kind of funding through the jockey clubs and things of, how we can kind of better manage these horses in their second careers. So I'd say that, having fetlock arthritis is not uncommon in an off-the-track thoroughbred. A lot of things need to be considered in terms of, especially with a pre-purchase exam. It'd be a different situation if you already own this horse and you're looking to manage it. With a pre-purchase exam, some of the things that we need to kind of take into consideration is, what do we ultimately want this horse to do? How kind of definitive do we need them to be able to do that? Do we have any wiggle room of their ultimate job? And what are they currently doing? So those are all certainly things, that I'd be taking into consideration, along with this horse's lameness exam and what the actual radiographs look like at the time of pre-purchase. So, I tend to be a little bit more wary if we have a lot of joint fluid there, or the horse is, quite sensitive to flexion, or we have overt lameness. Those certainly would be big red flags. It's always the gray zone of, we have the, the radiographic changes, but no overt lameness. So now what do we do? And, that's really where, the veterinarian and the, potential buyer really need to have kind of a heart-to-heart of, what's going to be this horse's job? How much do we love the horse? I certainly go into a lot of pre-purchase exams that, technically are still pre-purchase exams, but the buyer already is kind of dead set on buying the horse. So we certainly come across a lot of situations like that. And then it turns into more of a, okay, well, do we come up with a management scheme for, if this becomes a problem in the future? So there's lots of different things that need to be kind of weighed into that decision for sure. And certainly one where, the veterinarian and the buyer, kind of look at the radiographs together, look at the horse together, have a really good conversation of what the goals are and what you're willing to, to potentially risk. Are you okay with having a horse that you potentially need to manage this joint? Or, are you really wanting a horse that, I'd say it's an extremely rare situation that I come out of a pre-purchase exam and find absolutely nothing, on a horse. We all have our bumps and bruises, but there's a lot of different things to kind of take into consideration there.
Great. And then Dr. Settlage, going right off of that, can you talk a bit more about pre-purchases and just looking at issues in general on horses who have been in jobs since they were young, for example, thoroughbreds and other show horses that have been competing and doing things since they were young, and anything that people might want to keep an eye out for as they transition them to their next careers and what they're doing with the rest of their lives?
Yeah, that's a great question. The horses that have started out in one career and had a life in that career are going to come out with that career's likelihood of issues. As Dr. Secor said, thoroughbreds that have been on the track often do have fetlock and carpal issues. And from other disciplines, say it was a young cutting horse, might have issues in hind fetlock toxin cycles. And so knowing what the original discipline's problem areas can really help a future owner tailor their expectations and where they're keeping an eye out for potential issues. So in the horse you talked about before that was coming off the track and was diagnosed with some arthritis in the fetlock, weighing what's the desire for this horse in the second career. Is it just going to be a trail horse? Do they want it to be an event horse? Because many of these off the track thoroughbreds can go on to be high level event horses quite successfully, despite having had even a successful career on the racetrack. And so what's the degree of joint wear and tear that happened as the young age will also help determine what that horse's future is. And then just sitting down, as Dr. Secor said, down with your veterinarian, figuring out what the horse's current issue, how well what they currently have is removable, and looking forward into what those sports might also add to the horse's wear and tear, your love's wear and tear, and trying to figure out, is it a good match? And if you're lucky and you find a second career horse that doesn't have much wear and tear, then you might not have to think about much about that. But if there is a lot of wear and tear, say a decreased range of motion, or even some osteophytes or some joint fluid, or even some overt lame, then you might have to accept some basic maintenance that a horse might need to do their second career. So a lot can go into that, and deciding if that horse is right for you, just sitting down and being honest with your veterinarian, I think would be really helpful.
Great. So for everyone listening at home, we have a little over 10 more minutes, and we definitely have time for some more questions coming in. So if you have anything you want to ask, definitely send that in. And then also through our pre-registrations, we got quite a few questions about supplements and nutrition. So we're going to touch on that a little bit then. So first, for Dr. Secor, Heather in Alberta said that she's seen an abundance of joint supplements on the market, and she's wondering what she should look for in picking one.
Yeah, joint supplements this is another area where we could do like a full hour kind of discussing pros and cons and stuff. So I'll kind of give my thoughts on joint supplements, and there's lots of different, opinions out there. So a lot of the research with kind of the components of joint supplements, a lot of the research has been done in what we call in vitro experiments. So essentially in a lab with looking at, cartilage cells and things like that, but not necessarily in the full animal. And certainly a lot of the, so glucosamine and chondroitin sulfate, two of the most common ones that components that we see. And certainly, there's a lot of literature out there showing benefits in cell culture models and things of that nature. There's certainly a lot of, I guess not a lot, more research on the human side. But that doesn't necessarily transfer over into horses necessarily very well. One other problem that we kind of have with the joint supplement, or what we call like nutraceutical market, is it's pretty unregulated. So with drugs, everything has to go through FDA approval, and there's a lot of regulations and things that they have to demonstrate. Versus joint supplements and nutraceuticals, things of that nature, are much less regulated. So, certainly they could say that, they contain X, Y, and Z on the label, but there's not actually typically any regulating agencies checking that that's accurate. So that's kind of the con side of joint supplements. That being said, I certainly have patients that I use them in. There's some companies, unfortunately, they tend to be the more expensive ones because they do the research and development. But certainly some companies do, put aside some funding for, the research side and some more of the kind of quality control side. And those are the ones that, if I have a situation where an owner really wants to try one, those are the ones that I tend to reach for first. Because I know they've got some research to back them up. They, have a little bit more quality control than some of the other ones out there. Chondroitin, sulfate, and glucosamine are probably two of the most common ingredients. And honestly, it's hard to find a joint supplement without those two. But those are the two that probably have the most research kind of on them. So usually what I'll tell people is if you want to give it a try, go with one of the kind of well-known companies and give it for 3 months. See if you notice a difference. If you notice a difference, great. You can decide at that point whether you want to keep going with it or not. If you don't notice a difference, it may not, be worth continuing in your horse. So it's a tricky topic for sure.
Perfect, thank you. And then Dr. Settlage, keeping with nutrition just for another minute. Emily in Pennsylvania is wondering what nutritional adjustments, aside from supplements, she can make to promote good joint health.
So good question. And I am a keep it simple type of person, and just a good balanced diet for your horse that is forage based. And rarely will you go wrong at that point in time. And so if you don't know what a good balanced diet for your horse is, please ask your veterinarian. There's a lot out there that says that veterinarians don't get any nutrition education, but in fact, we do get nutrition education. And your horse veterinarian specifically has a passion for horse nutrition as well. So use them as your partner to figure out what it is that a balanced diet is for your horse that's forage based. And forage meaning your hays and pasture based. That should be the basis of most of the calories your horse is getting. And then after that, adding on any needed grains for calorie and energy purposes. And again, I like to stick with the known nutritional analysis brands instead of a feed mix that is that you don't know that, or you're just adding just oats or just corn or just whatever. I think a more well-rounded grain is better, only if your horse needs it. And then a ration balancer to make sure that they are getting the appropriate micronutrients, minerals, and other nutrients that they might be missing in their diet. And your veterinarian can help you with that. But I'm keying in on part of that question that said, in addition to supplements, because I think that supplements should be just that, is supplements, that they don't make up for a deficient diet. And so if you don't know if your horse is on a good diet, you can get hay analysis and you can match that with your grain or your ration balancer and make sure that your horse has the right nutrition. And we can't forget the number one thing that our body is made up of, and so is a horse's, and that's water. Making sure that your horse has a really good, solid source of very clean water, because if they're even like us humans, we're walking around a little bit dehydrated all of the time, that doesn't set us up for good joint health. And if we can make sure our horses have really good sources of really clean water, then that will also go a long way to keeping your horse healthy, and then also help keeping the horses having enough lubricant in their joints, even at small levels. So start there.
Great, thanks. That's super helpful there for everyone. We had a plethora of nutrition questions, so I'm hoping between those two we kind of covered at least touch on some of those topics there. And then
Great.
next, we have from our live chat, we have Judith, who is wondering if there's any new kinds of treatments, such as PRP, that you are excited about. And I'm going to go to Dr. Secor for that one.
Yeah, this is a great question and an area of research that is continuing to expand every day. So there's a lot of kind of what we call the kind of biologic treatments. So things like PRP or platelet-rich plasma, interleukin-1 receptor antagonist protein or IRAP, if you guys have heard of that, still certainly fall under the biologics category. And there's new studies coming out every day on, both these treatments as well as other possible treatments out there. One thing, and it's an area that I'm studying as well as a lot of other people right now, is how to pick which treatment for which horse. And, right now we don't necessarily have great information out there as to which one of these myriad of treatments might work best for a given horse or a given case. So a lot of research groups are kind of working on how to kind of characterize some of these, because we think of osteoarthritis as a single kind of disease entity, but there's a lot of different factors that go into it and a lot of different kind of subtypes of osteoarthritis. And there's some really exciting research kind of going on of how to kind of subtype these different types of arthritis and hopefully how to pick better, what treatment might work for a given horse, or person or dog or any other species out there. But there's certainly a lot of exciting research coming out, both on, like I said, these PRPs and IRAPs, as well as some other kind of up and coming treatments as well. So, lots of things that are kind of still early in the works, but definitely, every day groups are kind of making strides towards hopefully finding, better treatments or, fine tuning how to pick those treatments for a given case.
Great. And then for our last question of the night, for Dr. Settlage, basing off of that a little bit, what are your thoughts on acupuncture and other alternative type therapies, such as chiropractic work, for joint discomfort?
It's a great question. And so just so the audience knows that I am a certified veterinary acupuncturist, so I actually adore this question. I think that both acupuncture and chiropractor can play a role in just whole horse health, and specifically in horses that have soft tissue or joint related lamenesses. The horse is going to carry themselves differently, and so they might need a chiropractic adjustment to help encourage them to correct maladjustments that are a result of them carrying themselves differently, and so that will help encourage their body to carry themselves more normally. And then if we can get that pain under control that's causing them to travel unevenly, then that's even better. And so both chiropractic and acupuncture can really be part of that whole horse treatment for lameness, where both of those modalities can be helpful for decreasing the pain associated with the lameness, and then be part of their therapy going forward. So it plays a role. I am not in the camp that chiropractic and or acupuncture can fix all things. It is part of the treatment plan. I certainly use acupuncture on every single horse as part of my diagnostics. I just do a quick acupuncture exam on every horse that comes my way. And then if I believe that based on my Western diagnostics and treatment plan, if I'm only certified in acupuncture, if I think acupuncture can be beneficial, then I'll certainly recommend that. And then if I think the horse would definitely benefit from a chiropractic adjustment, then I will help the owner find a veterinary professional to do that as well. So yeah, part of the picture, and certainly can be very helpful for horses that have lameness.
Great. Well, I think we covered a lot tonight, and unfortunately that is all we have time for. So I would like to thank both of you for joining us tonight.
I had a great time.
Thank you.
Thanks so much for inviting.
Great. Thank
Yeah,
you so
thank you. This has
much.
been great.
And then also, of course, thank you to Boehringer Ingelheim for sponsoring this event. And finally, thank you to our audience for listening and sending in so many great questions. Until next time, from everyone at the Horse, have a great night.